Okay, so we're going to go ahead and get started. My name is Mallory Schneider, and I am a clinical support administrator for UM-NSU CARD. I work at the NOVA office. And this webinar is being recorded, so for if you know someone that isn't able to join right now, you'll be able to share it with them afterwards. And right now you should be able to see and hear me. You should be able to see my PowerPoint, and you should be able to see a chat box where you can type throughout my presentation. That's for the purpose of asking questions or making comments. What I probably will do is leave all of my question and answer time for the end. So if you do have a question throughout the presentation, just type it in the chat box, and when I'm done presenting, I'll go back from the beginning and try and answer as best as I can any of the questions anyone asked. We'll wait another 30 seconds or so, and then we'll go ahead and get started to see if anyone else will join. But today we're going to be talking about the different therapy options for your child with autism spectrum disorder. There's a ton of different therapy options out there, but today we're going to focus on the main three, which are speech therapy, occupational therapy, and behavior therapy. If someone can just type in the chat box so I know it's working, a simple hi, something like that is fine. Okay, great, thanks. Glad you guys can hear me. So once again, any questions along the way, jot them down yourself, type them in the chat box, and I'll leave about 15 minutes at the end so we can answer any questions, or I can clarify anything if you guys need me to do that. Okay, great. So let's get started. Okay. So autism spectrum disorder. Autism is a spectrum disorder, which I'm sure most of us know, and that means basically that symptoms are going to range in severity level. So we may have a high functioning autistic person, meaning their symptoms are very mild, to a low functioning autistic person, meaning their symptoms are very severe, and this can range along the spectrum. So because every individual with autism is different and it is a spectrum disorder, every treatment is going to be different. There's not one designated treatment plan for individuals with autism because every individual with autism is so different and their symptoms are so different and the way they present are so different. So all treatment really needs to be individualized to that specific child and that specific person. And as parents, whether you're a parent, whether you're a professional, whether you're a teacher, it's really important to determine what treatments are going to work best for your individual child. So your neighbor, your friend also has a child with autism, and they may say, well, I'm doing X, Y, and Z for Billy. That doesn't mean you're going to do X, Y, and Z for your child. They may have a completely different treatment plan. So it's very important to make sure that you individualize your treatment plan for your child. So how do you choose? How do you know what therapies and what interventions you should be using with your children? Choosing the right therapies and interventions can be very confusing, overwhelming, and intimidating. Like I mentioned before, there's a ton of stuff out there. There's a ton of research articles, and sometimes you're going to sit there and ask yourself, how do I know if this is the best thing for my child? And it's just important to conduct the research yourself and read up on articles and evidence-based practice and see what's worked in the past, what hasn't, so you can select the most appropriate interventions for your child. Weighing out the options is, it's definitely a process, and like I mentioned, it can be really overwhelming at times, especially in the beginning, but it's important to, think carefully about it, because choosing the right therapies and interventions early on, it's going to really, really be helpful for your child. Okay, so some things to consider. So you might want to consider the following questions when you're going through that process of figuring out, what are the best therapies and interventions for your child. So some things you want to consider. You want to think, does the method meet the strengths, challenges, and goals for your child? Is this going to benefit your child? What are the harmful side effects or potential risks? I mean, if your child has huge sensory issues, do you want to throw him into sensory integration therapy at the age of 18 months? We're not sure. what positive effects can you expect to see from this therapy? So going over the cons, but also going over the pros. What are you going to get out of it? Is the end result going to help your child in school, in the home, in all different kinds of settings? What are the short-term effects and what are the long-term effects? So what can you expect to see a month into therapy, and what can you expect to see after a year of therapy? Are they different? Are they things that you want to happen within the next year? How will you know that your child is making progress towards the desired outcome that you want? How will you be able to tell? Are you going to see a difference right away? Is it going to take 6 months? These are all things that are important to consider. Not that one weighs heavily over the other, and if one aspect is missing, then you shouldn't do it. But these are just things that are important to go over, so you are, confident in the decisions that you're making for your child. Okay, so determining effectiveness. So we went over the questions you should ask yourself. Now, these are some tips for you to help you determine whether the treatment is effective for your child. So you may want to implement one treatment at a time, because this will allow you to see the effects of that one particular treatment. I kind of go back and forth with this one, because in a way I think, a child may need multiple therapies at the same time, but then at the same time, how do you know which therapy is really helping? And if you stop one, but maybe that was the one helping, that might not be beneficial. So maybe it would be nice to, kind of do it in a more of a sequence, where you start one and then 2 months later you start another, and so forth. That's just an opinion that some people may have. Other people just go full throttle in, and speech therapy, behavior therapy, and OT, all starting within a 2-week span of each other. And if that's working and that's helping the child, then great. However, you really may not be able to know at that point which therapy is really doing what, and which therapy is being the most beneficial, which therapy you need to continue. So that would be the downfall of starting everything at once. But if the child really needs it, then that might be the best option. It could be nice to keep your own data. I know it sounds a little bit scary, but it doesn't have to be official statistical data necessarily. It could be just simply notes you're jotting down, behaviors you're noticing, improvements with the dates. So that way you can look back, weeks prior, months prior, and say, wow, they picked up this skill a month ago, and now they're already moving on to this skill. So clearly what we're doing is helping. Or the opposite, they picked up this skill a month ago, but then they haven't done this skill since. So what's going on with that? This personal record is going to allow you to see any changes. Especially, I think it's nice for the home setting, because you're probably one of the only people that is going to see your child at the home, unless you have a therapist come to your home, but that's not going to be more than a few hours a week. So as a parent watching your child in the home, you're going to see things that their therapists outside of the home are not going to be able to see. So you might be able to share that information with the therapist. You want to seek objective information. So maybe try not telling other adults, other people that are really involved in the child's life, that your child has started this therapy, and that way you won't have any bias as far as feedback goes. So maybe don't tell the grandparents right away. See if they notice a change. Maybe don't tell, a camp counselor, an after-school care program, unless it's, really necessary and you feel that it would be really important for them to know. It might be a nice way, at least in the beginning, to see if you can get any unbiased feedback as far as whether or not changes are occurring. And then you want to collect data from those involved in the treatment implementation. So just as I was saying that it's important for you to keep data, it's also really important for the professionals working with your children to keep data, like the teachers and the clinicians and the therapists. More so for their records, so they can see how your child is progressing, but also what I mentioned before, in the sense of comparing your data to theirs. What's going on at the home versus what's going on at their school versus what's going on at therapy outside of school. And that way, the team working with this child can really sit down and say, well, at home he's doing this, but at school she's doing that. So it's a really nice way to kind of get feedback and see where the progression's going and if any improvements are being made. You want to note the unexpected changes and the unanticipated changes. These are just, for data purposes again. And then you want to educate yourself about the treatment. So you want to look at the positive and negatives. Like I said before, educating yourself. Is this the best thing for my child? Super important. Okay. So how do you know when to start? That's a question we get a lot. Early intervention is critical. It is, that is where research is heading right now. They are looking at younger and younger children, because we see that the earlier you get your children involved in these therapies and start intervening, the better results you're going to get. I mean, it's not to say that starting your child in all these therapies at the age of 8 is a bad thing, but if you can start them at the age of 2 or 3, then that's a really great thing. So, it's important not to overwhelm such a small child, and, I don't know if it's the best idea to throw a 2-year-old into a 40-hour-a-week applied behavioral analysis program, but starting slow, starting gradual, getting them accustomed to things, and then allowing them to feel more comfortable, and then increasing the time. I mean, those are the years where you're really, really going to see a difference. And of course, as I'm sure a lot of you know, we're diagnosing a lot younger. And if you have that diagnosis, don't wait. Don't sit around and contemplate and say, oh, when they get to kindergarten, we'll start. When they get, into elementary school, we'll think about what we want to do. If you have that diagnosis and your kid is 2 years old, get started, because that is where you're going to see the most results, and that you're really going to be amazed at what early intervention really can do for a child with autism. And then research states that children who enter intervention programs at a younger age are going to make greater progress than those who enter the same programs at an older age. Not that the older kids are not going to make progress, but the younger kids are going to make more progress. And I mean, Google it. There's millions of research articles out there that are going to support this idea. So early intervention, put it in your brain, super, super important. Okay, so the most used therapies. So like I said, there's a ton of therapies for your child with autism, different interventions, different methods to use, but today we're going to talk about the 3 most widely used and frequently used therapies for kids with autism. So that's speech therapy, occupational therapy, and behavior therapy. So we're going to go into the basics and kind of the general idea of what each are. And the goal, and my hope in this is that once you learn a little bit about more of these therapies, maybe a light bulb will go off and you can say, wow, my child would really benefit from that because they have those, challenges that Mallory was just talking about. So that hopefully, by getting a better basic kind of general explanation of these 3 therapies, you can kind of see if your child would benefit from any or all of them. Okay, so we're going to start with speech therapy. So speech therapy addresses a wide range of communication problems for children with autism. Because autism affects speech, language development, and social communication in a number of different ways, we often turn to speech therapy to, work on those challenges that so many kids with autism face. And it's widely used and it's frequently used, and it really helps children, with both speech and communication problems. Okay, so communication difficulties. So like I said, individuals with autism have speech difficulties and communication difficulties. And we're talking about both verbal and nonverbal communication skills. So it's not just what's spoken, it's nonverbal communication skills as well. And so once again, speech therapy is a central part of autism treatment. Okay, so speech problems. So an individual with autism spectrum disorder may face speech difficulties in the following ways. So these are just some different areas that a child may have challenges in. They may not be capable of speaking. We call this a child who is nonverbal. They're just not able to verbally express the way they're feeling or their wants and needs. They may speak, but only in the form of grunts, cries, shrieks, or throaty, harsh sounds. So they may not be able to enunciate words and sentences, but a verbal tone does come out of their mouth. They may hum or speak in a musical way. They may babble. So once again, they're able to express something verbally, but it's not a word or a sentence. They may use robotic-like speech, which we'll get to in a little bit. They may repeat what another person says, which is called echolalia, which we'll also get to in a little bit. And then they may speak appropriate phrases or sentences, but kind of in an unexpressive way. A lot of times our kids with autism that are verbal speak, but with a very flat affect, with no emotion, with no sensitivity. It's kind of, that goes back to the robotic type speech also. Okay, so echolalia. This is a very common symptom in children with autism. It's the repetition of vocalizations that are made by another person. So there are two types of echolalia. Immediate echolalia, which the child repeats something they just heard. So if, they're in a room with a bunch of people and someone says, wow, it's a beautiful day outside, the child may say, wow, it's a beautiful day outside. That would be immediate echolalia. And then we have delayed echolalia, which is the child repeating something that they previously heard. This could be hours ago, days ago, weeks, months, years ago. It's something that stays in their brain for whatever reason, and they decide to repeat it at a very later time. Maybe a month ago, they were visiting grandma. Grandma said something. They're in school. They repeat what grandma says. So these two types of echolalia are both extremely common in kids with autism. Okay, so communication problems. So in addition to the speech problems, like we were just speaking about, the child with autism may face some communication problems as well. Difficulty with conversational skills. So this includes eye contact and gestures as well. These are nonverbal communication problems that the child may face. Trouble understanding the meaning of words outside the context in which they were learned, maybe taking things really literally. Memorization of things heard without knowing what's been said. So they may really not fully understand what they're saying, but they have memorized it, and so they're going to say it. The reliance on echolalia is a main source of communication. So that kind of ties in with the last point, which is the lack of creative original language. So they're verbal, they're able to speak, they're able to get those words and sentences out there, but they can't really think of what to say on their own. So they rely on what other people are saying, and then they simply repeat it. Or they rely on what they heard in a movie. That is kind of the lack of creative and original language. And then a difficulty understanding the meaning of words and symbols. That's a huge communication problem. Okay, so how do we integrate speech and communication? So a child with autism has difficulties in both, like we said, so it's important for speech therapy to focus on both speech and communication, not one or the other. It's our goal to aid children in speaking as well as using language to communicate. So we want them to speak, we want them to verbally express their wants and needs, but we want them to understand what they're saying. The two go together. Using language to communicate includes knowing how to hold a conversation and then turning into both your verbal and your nonverbal cues. And nonverbal cues like facial expressions, tone of voice, body language by other people, the body language you're giving off. Those are all huge communication skills that a child with autism may lack, but speech therapy is going to really help them understand these speech and communication skills and learn how to use them themselves appropriately. Okay, so who's conducting this speech therapy? So speech language pathologists, they're highly educated and trained therapists, and they specialize in treating language problems and speech disorders. So that will be who is conducting the speech therapy with your child. Your child's SLP is responsible for communicating with you, your child's level of speech or language difficulties. So you want to have that constant communication with your child's therapist. Determining the extent of the communication problems, how severe they are, maybe even having the ability to tell you how long, they think the therapy will need to go on for, how many sessions, what's the frequency of speech therapy that this child needs. What are the treatment options? What can we do to help promote these speech and communication skills in this child? And then creating and carrying out an individualized treatment plan. So remember, we said earlier that every child with autism is different, and this is why your child's speech language pathologist needs to create an individualized treatment plan for your child. They can't use the same treatment plan that they use for, their last 3 clients. They need to create something new and original and something so distinct and personal to your child that's really going to tackle those specific challenges your child is facing. Okay, so who the speech language pathologist interacts with. So they're going to have one-on-one therapy with your child, but the SLP also is going to work closely with you and the rest of the child's family, the child's school, their teachers, and then other professionals like a pediatrician, your card clinician. It's a circle, and everybody needs to work together in order to allow this child to reap the benefits of going to all this therapy. Okay, so speech therapy techniques. So these are different things that the speech therapist might use in a session, or what might be on the treatment plan. They may have electronic talkers, so this kind of goes in sync with an iPad, and there's a lot of fantastic new apps out there that speech therapists are using that help enhance communication and language, and they're really, really great tools to use in speech therapy. And also, it's really cool because if you have an iPad for your child, the speech therapist can show you the apps they're using in session, and then you can go home and put it on your child's personal iPad so they can continue that therapy at home. And a lot of them are really fun and interactive, so the child doesn't really realize that they're working. They may use signing or typing. They may use picture boards with words. They may use sounds to which a person is over or under sensitive to in order to expand and compress speech sounds. They may improve articulation of speech by massaging or exercising lips or facial muscles. And then they may have individuals sing songs to match a rhythm, a stress, a flow of sentences, all these different techniques. 1, 2, all of them may be used at certain points in your child's speech therapy. So what does the speech language pathologist address? Okay, this is the big one. So these are all, not all, but these are a majority of some of the areas of concern that your speech language pathologist is going to address with your child. We're going to start with receptive language. So this is the understanding of spoken or written messages. So this includes identifying objects, adjectives, prepositions, people, stuff like that. Then we have expressive language, which is the production of language. And this includes things like sentence structure, verb tenses, regular and irregular plurals, length of utterance. Then we have articulation and phonology, which is developing speech sound production. The use of tongue, lips, and teeth to produce speech sounds. We have oral motor skills, so improving the range, rate, and strength of oral motor movements. This includes those massages we were speaking about, the massaging of your cheeks, your lips, your gums, brushing teeth, and methods to decrease teeth grinding maybe. Feeding and swallowing, so this is oral desensitization. This includes working on the ability to close your lips, manipulate your food, the food you're eating with your tongue, age-appropriate chewing patterns, safe swallowing, and desensitizing to different tastes, textures, smells, temperatures, and consistencies of food. That's a big issue for a lot of our kids with autism. And then social skills and play skills. So using appropriate social language. It's the ability to read facial expressions, understand those nonverbal cues we've been talking about, body language, and then age-appropriate play skills like sharing, taking turns, and playing independently with others. Some more things that the language pathologist is going to address. So pragmatic, the use of language in a social context. Cognition, the mental process of knowing. So what are we aware of? What our perception on things, our reasoning, our judgment. The alternative of augmentative communication, which is AAC. And this is the use of any device, technique, symbol, system to enhance communication abilities. This is going to help the child in speech therapy. PECS, picture exchange communication system. So this uses picture symbols to communicate our wants and needs. A child goes through a learning process that teaches the initiation of communication and then expands to the use of sentences. So many children who use PECS are going to develop some verbal skills and may graduate to speech to the primary form of communication. So PECS is really, really helpful. And communication boards, so made with pictures or objects that the child points to, removes. This is a nice way to communicate wants and needs. You may have a communication board with snack options, and the child can simply point to what they want for a snack, and there's no meltdowns or anxiety about what am I going to have for snack time. And then there's a ton more different techniques, but those are some of the main ones. So the goals of speech therapy. So what do we want to get out of sending our child to such an intensive therapy? We want them to articulate words well. We want them to communicate verbally and non-verbally. We want them to comprehend verbal and nonverbal communication, and this includes understanding others' intentions in a range of settings. We want them to initiate communication without the prompting of others. We want them to understand the appropriateness of communication. So this is knowing the time and place to communicate something. So for example, when do you say good morning? When do you compliment someone? When is it appropriate to do those things? Developing conversational skills, exchanging ideas, enjoying communication, playing, and interacting with peers. We want them, not to feel like it's a chore. We want them to enjoy it. And then learning self-regulation, which is self-control, how to stop themselves from saying things or doing things at certain times. Okay, so moving on to occupational therapy. So any questions about speech therapy, type it in the box. I'll answer at the end. Hope everyone's staying with me. If I'm talking too fast or if I'm talking too slow, just shoot me a chat and let me know. Okay, so occupational therapy. This is focused on promoting an individual's ability to participate in daily life tasks. So kind of the main goal of occupational therapy is getting our children to be able to function in everyday life. Because children with autism spectrum disorder have trouble communicating and interacting with others, their interests, activities, and play skills may be limited. So occupational therapy is going to help a child develop these skills in the home environment, school environment, and kind of everywhere else. Okay, performance areas. So occupational therapy is going to focus on promoting different performance areas. So these are some examples. Activities of daily living, like grooming, oral hygiene, toilet hygiene, dressing, feeding, eating, socialization, functional communication, and functional mobility. Also work and productive activities like educational and vocational activities, home management, meal preparation, shopping, clothing care, getting dressed, doing laundry, play or leisure activities like exploration and performance. All of these different areas, occupational therapy helps to help the child better understand and know how to use them in an everyday context. Okay, so who's conducting the occupational therapy? So just like we have a speech language pathologist, we have an occupational therapist. They study the human growth and development and a person's interaction with the environment through daily activities. So these therapists have an expertise in areas of social, emotional, and physiological effects of illness and injury as well. They work as part of a team, just like the SLPs do, with the teachers, with the parents, with the other professionals. Okay, evaluation procedure. So prior to beginning occupational therapy, the child is going to undergo an evaluation to assess their level of functioning and what's interfering with their everyday capabilities. And this is really important because this evaluation is going to be really telling of what the occupational therapist needs to work on during the therapy sessions. There's going to be very specific goals that are including but not limited to social interaction, behavior, and classroom performance, and kind of just those everyday skills we were speaking about. Okay, so what the occupational therapy notices. So during the evaluation and while observing the child, the occupational therapist is going to pay close attention to these few things. So attention span and stamina, transition to new activities, play skills, need for personal space, response to touch or other types of stimuli, motor skills like posture, balance, manipulation of small objects, that would be fine motor skills, aggression or other types of behavior, and then interactions between the child and their caregivers. Okay, so occupational therapy strategies. So occupational therapy is going to combine a variety of strategies in order to better help your child respond to his or her environment. Things like physical activities. So that is, examples of that are like stringing beads, doing a puzzle, helping your child to develop kind of coordination and body awareness. Play activities. So this helps with interaction, communication with peers, with adults, with siblings. Developmental activities like brushing your teeth, combing your hair, things that the child should learn as far as developmental milestones go. And adaptive strategies, so coping with transitions, going on a vacation, doing something out of the ordinary, moving from one class to another, a break in a routine, those kind of things. Okay, so the benefits of occupational therapy. So like we said, because they focus on everyday life skills, going through occupational therapy, that's really going to help a child develop his overall quality of life and be able to improve that. And then the therapist guides the child by introducing, maintaining, and improving skills so the child can grow to be as independent as possible. And that's really our overall goal. We want our children to be able to function in society when they get older on their own, live on their own, hold a job, and OT at a young age is really going to start preparing them for those things. So occupational therapy skills. Okay, so the occupational therapy is going to focus on one or more of the following skills. So daily living skills like toilet training, dressing, grooming skills, fine motor skills, holding objects, handwriting, holding a pencil, things that a lot of things you do with your hands. Gross motor skills, which are the bigger movements like walking, climbing stairs, riding a bike. Your sitting, your posture, perceptual skills. Perceptual skills are telling the difference between things like colors, shapes, sizes, the awareness of your body in relation to others. Visual skills like reading and writing, and then play, coping, self-help, problem solving, communication, and social skills. All of these different skills your child may have challenges in, they may not. That's why the evaluation is done. So the occupational therapist can look at all these different things and say, you know, what areas need to be worked on. Okay, so sensory integration therapy. So sensory integration therapy is a huge part of occupational therapy. And because so many children with autism have problems processing sensory input, occupational therapy has a goal to work on these processing issues. So some examples of sensory integration therapy include being brushed or deeply touched or massaged, compressing your elbows or your knees, swinging, spinning on a scooter, or wearing a weighted vest. Because sometimes our kids are seeking the sensory input or they need more of a sensory output, it's really going to be individualized and depend on what that child needs as far as their sensory issues go. So why do these children need sensory integration therapy? So what I mentioned, and then also sensory integration, it's a process used by the brain to locate, sort, and make sense of incoming sensory information. So a child may have hypersensitive or hyposensitive sensations, which are going to impact their independent functioning in a lot of areas of their life. So for example, a child may scream when wearing a certain clothing because his or her sensory system is hypersensitive to that particular clothing. Maybe it's itchy, maybe they don't like the texture, it's too thick, it's too thin. But at the same time, same child may crave bear hugs or a really deep touch because their proprioceptive system is hyposensitive. Okay, so the goals of occupational therapy. So by addressing the skills we've listed, we hope that the child will be able to develop these different kinds of goals. So developing relationships, and this is relationships with everyone, with their peers, with their family, with adults, learning how to focus on tasks, learning how to delay gratification, expressing feelings in an appropriate way, engaging in play with their peers, and learning how to self-regulate, so learning how to control themselves. Okay, so that was occupational therapy. Any questions on occupational therapy? Type it in the chat box and we'll go over it at the end. And so now we're going to start the last therapy, which is behavior therapy. So behavior therapy is the idea of assessing why an individual with an autism spectrum disorder is behaving a certain way. Why are they doing the things that they're doing? And then what interventions can we do to help them change this undesirable behavior? Behavior therapy focuses on helping the individual with autism understand how changing their behaviors can lead to changing the way that they feel. It's a structured approach, and it measures what the child's doing, and then it seeks to increase the chances for more positive and desired behaviors. So applied behavioral analysis is behavior therapy. And this focuses on the principles that explain how learning takes place. Positive reinforcement. So positive reinforcement, it's the idea of when a behavior is followed by some sort of reward, we believe that that behavior is going to be more likely to be repeated because they got the reward. So we want to positively reinforce the desired behaviors, the behaviors that we want the children to have, in hopes that this will cause them to continue to reoccur. We do not want to positive reinforce the behaviors we're trying to get rid of, because then they're going to keep doing them. We want to instead take the behavior that they're doing that we don't want them to have, show them what they should be doing, and then positively reinforce that. ABA is a very widely recognized, safe, and effective treatment for autism. It's very widely used. And then it focuses on both basic skills and complex skills. So the basic skills it's going to focus on are things like looking, listening, imitating. And then the complex skills it's going to focus on are things like reading, conversing, understanding another's perspective. Okay, reinforcement. So this is a core behavioral principle. So I just want to touch on it briefly. It includes anything that a person does or says that increases the likelihood of the behavior happening again. So kind of what I was just talking about. When a child with autism is reinforced, he or she is likely to repeat the same behavior. And that really goes for everyone. I mean, if we are reinforced positively, we're going to want to do it again because we like that feedback. So for example, if a child performs a desired behavior that we want, like they're sharing their toys with their siblings, and you as mom or dad says, "Great job sharing with your sister," we can assume that this verbal praise was positively reinforcing and that the child is going to want to share with their sister again because they liked the way it felt when they got that positive reinforcement from mom or dad. Okay, so some types of behaviors. So you may be asking yourself, well, my kid doesn't have behaviors. What do you mean by behaviors? So a lot of kids with autism spectrum disorder have challenging behaviors, and this can come in the form of a bunch of different things. But some main ones that we see quite often are things like repetitive behaviors. So spinning, hand flapping, rocking back and forth, self-injurious behaviors like head banging. Dangerous behaviors like hitting, kicking, running into traffic, and then self-stimulating behaviors. And these are anything that a child does in order to kind of they're seeking that sensory input. So a child that has may hum often because they're seeking that oral sensory input. Okay, ABA improvements. So a lot of research study has shown us that ABA has the potential to improve some or all of these following characteristics. So things like communication, which is tied in with speech therapy also, social relationships, tied into OT, play, self-care, school, employment. So you can see that a lot of these traits that ABA focuses on, speech and OT focus on as well. So they're kind of all in sync with one another. So what the interventions actually involve. So just like the speech and OT, they're going to be customized to the individual's needs, skills, and interests. ABA for one child is different from ABA from the next child. But they're going to focus on the use of reinforcements, definitely. That is very important in behavior therapy. And then other important principles to increase behaviors, generalize learned behaviors, and then reduce these undesirable behaviors. So basically, we want the child to stop the bad behaviors and pick up good behaviors and use those instead. And because ABA is a consistent and ongoing process, it's really important that the interventions are evaluated to determine efficacy and then make modifications. So 2 months after starting, we may know that Johnny is not hand flapping anymore, but instead he's playing with a little stress ball in his hand, and it's not really disrupting, his learning. It's not disrupting his class. So we can move away from that. We'll focus on something else. So constantly evaluating the child and what's going on in therapy, making modifications, so we don't waste time and weeks, going over skills that the child already has picked up on. Okay, so the pros of ABA. A lot of pros of ABA because it's one of the most successful forms of therapy for children with autism spectrum disorder. It's really widely and frequently used because it works, and it really helps these children with severe behavior problems. Because the applied behavioral analysis therapists are required to keep such detailed notes of the clients and sessions, as every therapist really should, the research on ABA effectiveness can be easily conducted. That's why we know so much about it, because it's such a strict, rigid therapy program. And then the cons of ABA. So there are some negatives. It can be very labor intensive. We're talking sometimes 40 hours a week. It's like a full-time job. A lot of times this can be done for the younger kids. You have a 3-year-old who is not in school yet. So you decide as a parent to basically make ABA therapy school, and you have a therapist come to your home every day from 9 to 5 and work on these skills with your child, and it is a lot of work, and it is really labor intensive, but you're going to see really fantastic results from it. And it can be really expensive, especially depending on the frequency. If you're doing that 40 hours a week, it's definitely going to break the bank a little bit, but it's going to be really helpful. And then some children going through applied behavioral analysis develop robotic speech, which I mentioned before. So now we're going to talk about that a little bit. In a second. Oh, I thought we were. I guess not. Okay, I can just tell you a little bit about robotic speech. So because a lot of applied behavioral analysis therapists use kind of a system of drills and rewards, it causes the children to result in robotic behaviors, which display in the real world, and then they have sort of a disconnect because they're so used to learning these life skills in the setting of the behavior therapy room that sometimes they enact these skills in the real world and they seem very robotic and learned and not natural. So that's one of the cons of ABA, but a good behavior therapist should be able to work on preventing the robotic speech and the robotic behaviors. So when the child is integrated in school and at the mall and at a restaurant, they're not engaging in such a robotic way. Okay, so who's conducting the behavior therapy? So we have our speech language pathologist, we have our occupational therapist, and now we have our behavior analyst. So it could be a licensed clinical psychologist with training in applied behavioral analysis, or it might be a behavior analyst who is board certified. So a BCBA, a board certified behavior analyst. You've probably seen those initials after someone's name before. It's important to be sure that the practitioner you choose to conduct your child's behavior therapy is really well trained, because this is such a widely used and frequently used therapy. It's in high demand, and so just be sure that whoever is conducting a therapy with your child has a certification, has undergone the training. Okay, conclusion. This is our last slide. So wrapping it all up, we know that there's not one distinct treatment plan for your child with autism. You get the diagnosis handed to you. You also do not get a treatment plan handed to you of what to do next, which is why it can make everything really confusing, and it's a world of unknown, and you don't know where to go sometimes. But that's no one's fault, because every individual with autism is so different and is so unique and so special. So we really want to make sure we're tailoring their treatment plans to them and to no one else. The treatment plans are going to be just as individualized as your child with autism is. So maybe your child is going to benefit from speech therapy, occupational therapy, behavior therapy, maybe one, maybe two, maybe all of them. So just do your own research, see what you think is going to be able to help your child, and, you know, take it from there. Consult with other professionals, with teachers, with pediatricians, with your card clinician. You know, if you're not sure, and, you know, we're at CARD, we're so more than happy to help you make these decisions and determine what is going to be the most beneficial for your child. So if anyone has any questions, I'll wait a couple minutes and see what we get. And if you want me to go back to a certain slide, just type it in the chat box and let me know. I'm happy to do that as well. Okay, so we have a question. Okay, so I was asked if you're looking into ABA, where do you go to find certified ABA individuals in the area? Depending on what area you live, whether you live in Dade County, Broward County, or not, I encourage you to consult with your card clinician, and we can give you a list of different behavior therapy centers in the area. If you want to leave me your email address in the chat box, I'll jot it down, and I can look into the different behavior therapy options for you in your area. I'm more than happy to do that. Okay, we have another question. Oh, that's kind of a helpful answer. You can go to the BA, it's probably BCBA website as well. They have a listing of certified therapists across the country. Yeah, so you know, by working in Broward, because we're UM-NSU card, so Dade and Broward and Monroe County, we know great places in South Florida. If it's outside of South Florida, I would definitely encourage that, going to the behavior analysis website and kind of looking into it that way. You can also try and ask a local pediatrician or your child's teacher if they're in an autism cluster class. There you go. There's a website. Yes, I can definitely send you the list for Broward. Okay. Any other questions? Any questions about speech therapy, occupational therapy? Here you go. Yeah, so it was asked, you know, how do you document what behavior challenges your child is facing before you go to the appointment? And I think, you know, as far as taking your own data goes, I would definitely recommend writing down the different behaviors you see, maybe using simple tally marks, you know, how frequently they're occurring throughout the day, if they're occurring at, you know, certain times more than others, if, you know, they happen in the morning, or if they happen before I go to bed, or if it's during a transitional period. And this, you know, the behavior therapist is going to definitely do their own evaluation, but seeing your child in the home, which is something the behavior therapist may not see, this information is going to be really helpful to them. You know, a lot of our children with autism have some oppositional defiance behaviors, and we don't know if that's, you know, a comorbid ODD diagnosis, or if those are just some really intense behaviors stemming from the autism. So the behavior therapist is going to assess these oppositional behaviors. And, we hope that with time, the child will, have the ability to sit down, sit through a behavior therapy session, learn to respect the behavior analyst, and using a lot of the positive reinforcement, using a reward system. For example, if you go to behavior therapy for 20 minutes today, you get the iPad for an hour. If you go to behavior therapy for half an hour today, we can go get ice cream after, things like that. And it may not be such smooth sailing right away, but with time, the child should be able to get more accustomed to the behavior therapy. Just gonna wait for a few more questions. There you go. That's another good idea, counseling. If you think your child has the patience to sit through a therapy session, that could be really helpful also, with a psychologist. If you see these behaviors in adults, can they benefit as well? Yeah, I don't see why not. I guess it depends how severe the behaviors are. That would probably be a better question for our adult division. But I think it can really be helpful to anyone who is willing to sit through a behavior therapy session and learn coping skills and learning more desired behaviors that can take place in the way of those undesired behaviors. Um, that's not the more detailed ABA information. I really just wanted to go over the basics since I was covering all three. But since I have your email address, I can definitely send you some different articles and more links to read more specifics into ABA therapy, so you can kind of get a better idea of really exactly, specifics about it. I can definitely send you that. And also, if anyone wants a copy of this PowerPoint, please just type your email address in the chat box, and I'll be happy to send it to you. Yeah, absolutely. So whether or not the parent should be involved in the therapy. It depends really on the parent as how intensely involved you want to be, but I think the more the better. I think it's great if your speech therapist and occupational therapist especially kind of let you know what they're doing in therapy, what apps they're working on the iPad, what different skills they're working on, so that way you can do that at home, because a lot of times you're only going to meet with this speech therapist or occupational therapist once or twice a week, which may not be enough. So it's important as a parent to know what they're doing and then practice it with your child at home. Yeah. Some therapists are going to let you observe, some aren't. I know at the Nova Speech Clinic, we definitely let the parents watch, which is nice because you get to see, how your child's progressing, what they're doing, what they respond well to, and that way you can take that home with you. Just going to jot down everyone's email address. Yes, I will send everybody that provided me an email address a copy. anyone has any more questions. I'm happy to answer. Yes, definitely. ABA is very effective. If there are any behavioral issues, ABA will really help, especially starting your child young. It really helps diminish the undesirable behaviors and then allows the child to learn new behaviors, learn how to deal with them in the real world, and learn how to develop coping skills so that they don't digress to what their old undesirable behaviors were. Yeah, you could ask the school if I'm assuming you mean if a behavioral analyst can come into school to do the therapy. Most schools are going to be fine with that. And as far as adding it to the IEP goes, I don't see why that should be a problem. If it's an accommodation that the child needs, then they should be able to add it to his IEP. So this is a good question. So since ABA takes a lot of time, how do we allow a school age child to have behavior therapy? So the 40 hours a week is going to be more so for the children that are not in school, for the very young children. And then afterwards, we're going to be going to behavior therapy for about 2 to 3 hours in the afternoons and on the weekends as well, if you want it to be that intensive. Yeah, I've heard of some schools that will allow a behavior analyst in and some schools that don't. I guess it really depends on the administration and whatnot. But, you know, definitely private schools are going to be more inclined than a public school to allow that in. Yes, absolutely. If your child has behavioral issues, there needs to be an FBA, which is a functional behavioral assessment, and then a behavior intervention plan, a BIP. Those two things are crucial for the child, and that way their behavior at school can be documented by that. You can be documenting their behavior therapy at home, and all the documentation is going to be a bigger fight to get that behavior therapist in to help the child.